So number 9, medications. We just talked about nitroglycerin. All these other medications, I would encourage you to just look them up in the drug book. Just kind of get familiar with like how to give them, and just like their doses. Did they ask any in the last test any medication questions about those 4?
No.
Or were they just in like the scenarios?
I can't remember, but I don't think they really did.
Yeah. So yeah, just
Maybe it'll be more important this test.
yeah, and like you'll be exposed to them more, and it's just good to like slowly get you exposed to them. So not all of a sudden you're like, there's like 1,000 beds. So. Okay. Did she talk about digoxin at all?
Yeah, you have to check their pulse because it slows it.
Yeah. So the same with digoxin is it slows and strengthens. So for your cardiac output, it's going to slow it down so that you can get more out. So like if you think about it, like if your heart's going really, really fast, like with AFib, you cannot get that much out just because your heart's like freaking out.
So I know you're not supposed to give it if their pulse is under 60, but what if their pulse is like 62 or something kind of close?
It's just 60, so you can still give it.
Yeah, okay.
Kind of depends if you can look at their trends, because like when you give that medication, you can go reevaluate if it's oral 30 minutes later once it's in their system to kind of see what their pulse is. So if you look at those trends, and if they're, because everyone's different, if they want to drop a lot, then I probably wouldn't give it. It's kind of your own discretion when it's that close. But if they don't drop a lot, you can give it, and you can just ask them.
Okay.
Patient of a lot of things. So digoxin slows and strengthens the heart. So if you're making those, like the cardiac output slower, you can get more volume and push it out. So this one's huge. You see it a lot in the hospital. Super helpful. So yeah, precaution. Don't give if heart rate less than 60 beats per minute. Okay, that's huge. Because what happens if you gave it when it was like 50?
It'll slow it down too much.
Yeah, perfect. Okay. Another one you need to know, Lopressor. This one is a beta blocker. Do you know what beta blockers do?
It's probably like the sympathetic nervous system.
Yeah, so they're going to decrease blood pressure. So Lopressor is an antihypertensive. Okay. It also helps with angina. Just because it, like antihypertensives, angina. If you're hypertensive, usually it's because your blood vessels like really constricted, so there's more pressure on the blood vessels. But since this is antihypertensive, it's kind of going to dilate it. So that's why it can also help for angina, because it's going to dilate those blood vessels.
Okay.
Okay. That's good for number 9, so just look them up in your book, kind of become a little bit familiar with them. But these are the main things you have to know.
Okay.
And they're definitely going to ask you about digoxin, both of these things. They really stress digoxin.